Should we start, sir?
Yes, we can begin.
Good afternoon, everyone. Thank you for joining on a Sunday evening. Before we start, I'd like to give a brief introduction of our guest lecturer today, Dr. Sachin Desai. Dr. Sachin Desai is a public health specialist and an expert in the field of geriatrics, its practices, the various traditional and newer care models, the issues, and its preventive measures. Dr. Sachin Sir is a community medicine MD who has further specialized in geriatric medicine, public health nutrition, and is a master's in dementia studies from the University of Stirling in Scotland. He has also conceptualized and written a book on this topic titled Healthy Aging in a Changing World. Geriatrics being a field that often does not get the attention that is it is due, Dr. Sachin Sir's motto is reach the unreached. With this, I would like to hand it over to Dr. Sachin Sir for his lecture.
Thank you, Dr. Shafa. I would first like to thank Dr. Aksha Sheikh for giving us this opportunity and organizing this event. And I would also want to thank head of the department, Madam, uh, for this opportunity as well. So we would begin in a minute's time. Yeah.
Dementia prayer.
So is the slides visible to you, every one of you? Are the slides, is the first slide visible to every one of you?
Yes, sir.
Dr. Shafa, is it visible to everyone?
Yes, sir, it is visible. Yes, sir.
Okay. So greetings from S. Naginappa Medical College, Bagalkot, from Karnataka. I'm Dr. Sachin, and I'll be addressing the geriatric giants, addressing the principles of practice and preventive measures. So I'm working here in the Department of Community Medicine at S. Naginappa Medical College, Bagalkot, as an associate professor. And I'll be speaking today about the importance of how elderly care would be addressed in this modern era. So this is one quote which has been cited n number of times, but I would still want to repeat it. Everyone gets aged from day one to till today. Everyone gets aged, and it's an unavoidable phenomena. So as and when we progress from day one to as we grow older, it's an inevitable phenomenon. And what we have with us is that we can not completely treat it, but we can protect it, promote it, and extend it. So the headings of the guest talk, I would be describing it under the following headings. I would be first telling what are the geriatric giants. I would be describing related to dementia, depression, falls and fractures, caregiver burden and burnout. I would also be sharing about the pharmacological and non-pharmacological interventions and the newer initiatives. And we would also recommend, based on the levels of prevention and the measures and the newer initiatives would be highlighted in this talk. So I'll be describing 4 of the 5 geriatric giants, namely the dementia, depression, falls and fractures, and caregiver burnout and burden. Incontinence is a topic by itself, so I would just say it in a few in a slide or so. So as we all know, demographic transition is seen in India and in majority of the developing countries because of the better standards of living, because of vaccination, because of increase in the socioeconomic status, because of modern antibiotics and widespread immunization, improvement in the social conditions, and the specific location of a particular country and the cultural norms that are there, also in consideration with the literacy and the occurrence in a particular gender. So these are the different aspects which would be addressed and which would help in longevity of a individual in India, which is currently 66.4 in women and 65.3 in men, as per the 2011 census. So why is it that different countries age differently? We take into consideration Japan, which is having a very ideal lifestyle. The number of hours they work, the circadian rhythm that they maintain throughout, the geographic location of the country towards the eastern hemisphere, and you see majority of the Japanese are active, may it be physically, mentally, socially, emotionally, with all domains being functional till at least 70 or even beyond that, for which we would see octogenarian and centenarian senior citizens as well. India is emerging uh, as from a developing country to a developed country, but it has its own pitfalls, like migration to an urban area, emergence of nuclear families, and with limited caregivers to take care of the senior citizens at home, and leading to isolation of the senior citizens and dependence of these senior citizens on activities of daily living and instrumental activities of daily living. So these of a senior citizen are dependent by the caretaking of the caregiver, may it be a spouse, may it be a son-in-law or a daughter-in-law, or may it be a daughter who would be doing an additional job of caretaking apart from her daily routine of managing the house, bringing up the children. Plus, if they are working, then they would also be having this additional responsibility. So, hence, in the Indian context, we would have a totally different phenomena compared to Japan or any other developed nation, wherein there would be some advantages of the joint family in the rural area, but in an urban, you would have the creation and emergence of nuclear families. So these would be the you would rather say disadvantages in India, which would lead to caregiver burnout and caregiver burden as well, and dependence of a senior citizen on the caregivers. So this is a 2011 census age distribution over decades, as what was projected in 2011 about 2021. The current percentage is 10.5 or 10 point, ranging from 10.5 onwards in different parts of the country, an average being around 10.7. So this average, which was predicted in 2011, is exactly what is being seen in 2021. And so you can see the different age groups here, and we would be predominantly concentrating on the age group of 60 plus, which is projected to be 10.7 in 2011, and which is currently the same percentage. So we are addressing the senior citizens of 60 years and above, and uh, globally the percentage of senior citizens is increasing. This is because of the few factors which I just mentioned before. But the elderly are prone for large number of illnesses because of the lowered immune responses, the dependence financially on the, and they are prone for abuse because they are dependent on the caregivers or their spouse for the activities of daily living and instrumental activities of daily living. As a result of which, there would be some amount of stress and strain in the family, which needs to be addressed. So the common morbidities, which you have all read in our textbook of Park, this holds good even for this classification holds good for all settings and all subjects as well. The morbidities that we commonly witness in a senior citizens are because of the aging process, because of the long-term illnesses, and because of the psychological problems that they undergo during their uh, age, during their old age. So there are two important geriatric giants in the morbidities that are due to the aging process. One is dementia, and second is incontinence. Osteoporosis, failure of special senses, which will lead to diminution in vision, hearing, and mobility. So these are related to osteoporosis in the old age. So these are a few morbidities which are because of the aging process. So morbidities because of long-term illnesses include cancers, non-communicable diseases like diabetes, hypertension, coronary heart diseases, locomotor system, falls, fractures, and accidents, which is one of the a third geriatric giant. That's the fall prevention or the falls, fractures, and frailty, which I'll be describing in detail. Then we have the systemic illnesses like the benign prostatic hypertrophy, COPD, malnutrition, anemia, and frailty. Now, the third problem includes the psychological problems, which includes depression, which is also a geriatric giant. Then there is neglect, isolation, and social withdrawal, and dependence economically and on activities of daily living. There will also be emotional disturbances in the senior citizen because of their dependence and because they happen to be vulnerable individuals. Now, as per as per the term coined by Sir Bernard Isaacs, geriatric giants includes dementia, depression, falls, fractures, and frailty, caregiver burden, and incontinence. We would be describing the first four in detail, where I would be describing what is cognitive impairment, dementia, and Alzheimer's disease. So, the one with the aging process, we would see dementia. The commonmost form of dementia is the Alzheimer's disease. Common type of dementia is Alzheimer's disease. And cognitive impairment is one which is related to dementia as well as related to the physiological processes of aging. So the difference is that one, the Alzheimer's disease can be because of a pathological condition as well, along with a physiological condition. So conditions could be mixed in case of Alzheimer's. In case of cognitive impairment, it may be because of the aging process, but dementia can be any one of them. Okay, it may be either an aging process, a pathological condition, or it may be masked with Parkinson's or with depression or some other conditions which are similar, mimicking the features of dementia. So let us see what are the risk factors for dementia: advancing age, family history, clinical conditions with associated causes of vascular origin related to smoking and drug induced consumption of multiple drugs leading to uh, neurological changes, and then ischemia, secondary to ischemia, leading to dementia in the long run. There are social causes as well, which is generation of nuclear families, migration to urban areas, isolation, reduced literacy status, and elderly living all by themselves. So these are a few factors. There are 10 warning signs of dementia which we need to identify as a medical expert, or as a caregiver, or rather a person who is able to identify these. So when we are educating the caregivers, or when we are educating the interns or a postgraduate, these are the 10 warning signs that we would want to look for in a senior citizen or a person living with dementia who would show these warning signs. So first is the memory loss, which would interfere with the uh, daily life. For example, a person would want to look for a key, but he would not know why would the key be used for. He would want to he would have a cell phone in his hand, but he would not know what would be the use of it. He would want to solve an issue which is there in the house, but he would not know how to do it. He would have confusion related to, he or she would have confusion related to time and place, whether he is reach, or he where has he to go. He would have this confusion. He would also have a reduced ability to process visual and spatial relationships. where is he and where is he wanting to go. He or she would be just perplexed and would want to do an activity but would not know how to do it. Then trouble in speaking and writing. This is because of the area of the brain which is affected, the frontal cortex and the speech area, and even the areas related to the fine motor skills. So the seventh warning sign is frequently losing things. He would have kept a place, a daily use instrument at a place, maybe a remote or a charger, but he would not know in the second minute he would not know where he had actually kept it. So he would begin looking out for it. Then there would be changes in judgment and decision making. Okay, they would ask him whether have you had your tablets or your medicine, did you have your food? Is a common question that we would ask. Then he would say or she would say, yes, I did, but they wouldn't have actually had it. So these are the few the warning signs. There would also be work and social withdrawal, following which they would notice once a disorientation, or they would once begin to forget. There would also be mood and personality changes, which we need to identify and take a note of and pick them early so that they would be easy to identify and early to address. So there are a few repetitive symptoms in dementia, uh, especially the verbal ones, asking what time is it, where is his wallet or purse, whether he has had food or not, and he would want food again despite having food just a few minutes back. Repeated rubbing of the hands or tapping of the feet, not knowing what to do next. So, according to the Neurological and Communicative Disorders and Stroke and Alzheimer's Disease and Related Disorders Association, there are a classification of the criteria based on the course of the illness. So, why is this relevant here? We are going to address both the clinical and the preventive aspects in this. So, stage one would be for 1 to 3 years of the illness, stage two would be from 3 to 8 years of the illness, stage three from 8 years to 12 years of the illness. So, this is one slide which I'll be sharing once again, where every detail of dementia, the 10 early signs, the common issues of dementia, how dementia affects the language skills, the phrases to learn for caregivers, dementia video changes in vision, and late stages of dementia has been described by Teepa Snow, who is a graduate of Duke University and who has a degree in zoology. She has also received her master's degree from the University of North Carolina, and she has done extensive research on dementia. So these are the few we, videos related to dementia that I have shared a link, which we would go in and see post the session, or you could have a look at it after the session related to dementia. So uh, these would give an exact picture or an image or a process of how dementia would progress. So related to Alzheimer's disease, this is one form of dementia which is more than half of the people with forgetfulness would uh, experience or would have neurodegenerative changes with memory deterioration and cognition being affected. So they would also have neuropsychiatric conditions like agitation, aggression. It's more common in women than men. And apart from cognitive defects, there would also be a difficulty in speech, difficulty in performing smaller tasks related to writing or performing simple tasks at home, difficulty in uh, understanding or experiencing smell, disturbances in executing activities of daily living or instrumental activities of daily living, which includes ADL includes bathing, having food, then grooming, wearing clothes, and toilet. Instrumental activities of daily living includes shopping, then banking, then uh, daily activities like going and buying vegetables. Then there would be other activities which you like a using of a telephone or operating equipment at home would be affected in Alzheimer's as well. So, how do we classify the Alzheimer's disease? We would classify them into cortical and subcortical dementia based on the site and location of the lesion. Then it could be of a vascular origin related to causes of drugs, especially the medicines, polypharmacy, and ADRs, and long-term usage leading to medication cascade, okay, which is a term wherein we use multiple medicines, one adverse drug reaction leading to the other, and then as a complication and long-term usage of a particular drug, they would have medication related cascade, which would lead to hypoxia of the CNS tissue and leading to, in the long run, Alzheimer's disease. Now, what's the plan and how do we address this issue? So, there are prescribing guidelines for this disease where we would prevent or the progression, or we could prevent or slightly delay the progression. So, we could prescribe as per the guidelines of care where we would identify the cause, adjust the dose, and we would also want to identify the adverse drug reactions that would emerge out of the drugs that we are going to prescribe. So we would be prescribing according to the Beers criteria and according to the start and stop guidelines to prevent adverse drug reactions following polypharmacy. So the seniors have to develop a routine which was similar to that which was even before they would have developed the signs of dementia. They should be encouraged to perform or do their hobbies or pursue their hobbies, which they did before the early signs of dementia emerged. So the seniors have to be removed from the stressful situations. We have to respond to their stresses or emotions. We have to divert their attention to a positive, familiar, repetitive activities so that anxiety wouldn't be created from an unfamiliar situation or an unfamiliar uh, room or an unfamiliar place that they are left in, which they would anticipate when they are showing signs of dementia. Okay, as even the commonest living room or the bedroom would require directions with a placard to show that where they would have to go. So if they are not allowed to develop agitation or aggression because of such small situations or agitation or aggression arising from situations related to not able to find a room or not able to find the toilet or such small situations, we could prevent. We should offer reassurance and communicate effectively with the caregivers as well as the senior citizens who are living with dementia. So, how do we make a senior citizen friendly or a dementia friendly and safe home or a safe dwelling? So, people with dementia tend to wander away. They would return or they would return later or much later than normal when they are suffering from or when they are showing signs of dementia. They would attempt to go to a workplace even after they retire. They would find difficulty in familiarity in finding places within the house itself. So how do we prevent this? Bringing about small changes like introducing drug boxes, which could prevent multiple medication intake, which could prevent polypharmacy and avoid a cascade of reactions following double or uh, taking a medicine for twice because of the forgetfulness can be avoided. So there's one option wherein this drug box could be timed at a particular time and it could be So there are devices which have been there in the market but need to be placed in order to get these, wherein the drug box would be timed to open the slot of the drug which would be delivered would open up only at a particular time of the day. And if the senior citizen would attempt to open it, it would not once it has dispensed the drug already. So this would prevent polypharmacy and medication cascade arising from it. So there would also be other. So there's one issue which is related to forgetfulness after having meal. So this issue would lead to nutritional deficiencies, and the role of the spouse would be very important here to slightly divert this question. And if they have already had the food, if they haven't, to see that the meal is being provided. So how do we prevent wandering? So create a structured routine which they already followed before. Instill locks out of the direct line of sight of the senior citizen so that he shouldn't feel that he has been locked inside a house. We have to install devices that alert the windows or doors that when they are opened to a person who is having the sensor or a watch which could receive the information about the door opening through either a sensor mechanism, or they could get it through an app which is in the caregiver's phone or in the caregiver's watch. Marking signs on the pavement, signboards, directions, indicators to navigate, GPS tracking devices, bracelets or ID cards with contact details of their son, daughter, or daughter in law's number on it would be very important. GN technology, where they would use door sensors in devices with the devices which could be described in the caregivers as a sensor when opened. So, what are the safety measures at home? Storehouse chemicals should be kept out of reach to avoid unwanted poisoning of the seniors who could uh, forgetfulness consume this. So the caregiver's role would be very important. So there would also be general measures like locking the doors of the basement, attic, and garage. There would also be adherence to medications or pill box and avoid smoking. Just a second. So these are a few measures which we need to take into consideration when we would be addressing the safety of the senior citizens at home. There are also a few treatment measures which we need to treat, which can halt the progress or halt the further changes related to dementia. So it in 50% of the individuals it would halt, but along with other supplementary like vitamin D exposure, antioxidants, then cholinergic strategies like Cognex, Aricept, and Exelon. These are a few trade names, but it's staccarin, donazepam, or rivastigmine, which needs to be given. So these a few NMDA antagonists are also given. So this is one measure. Just a second. So this is a total classification of the description which I gave till now. So there are two types. One is cognitive impairment and Alzheimer's. So differentiating feature is that there was a pathological condition here in Alzheimer's, and cognitive impairment is because of the aging process. So the predominant presentation would be memory loss, changes in thinking, attention and calculation, decline, difficulty in reasoning, judgment, perception, mood, and behavioral changes. So, what is it that we would want to address? We would want to uh, check for electrolytes, thyroid function test, vitamin B12, folate, tau protein, CSF, and use acetylcholine esterase inhibitors, cholinesterase inhibitors, and NMDA antagonists. So, what are the non pharmacological interventions with which we can address dementia? Short term care includes prevention of burnout in the spouse or the caregivers. Long term care includes progressive, all inclusive care of the elderly through either daycare centers, home care providers through NGOs, nursing home care. One initiative is adopting a grandpa, wherein we would adopt a grandpa. School children would be asked to adopt a grandpa among those who are residing in their own area. We would also be using music therapy, wherein music that they had listened to in their yesteryears or the one that they loved could be played again to rewire the neurons. Nature therapy, which is also known as Shinrin Yoku, where which is a traditional uh, which is a traditional what do you call an event or a procedure which is followed in Japan, which was first which began there, and people would with living with dementia would be asked to spend their time amidst nature, so the agitation, aggression, and the negative symptoms of dementia would come down. Cognitive stimulation exercises like Sudoku, chess, and caregiver education would be an important aspect to address. Depression is a second important cause that we would be addressing. It's a major public health problem, especially the women in the reproductive age who develop depression are more prone for complications in the later days. So, the distinctive feature among the elderly is that it's an emotional state and they don't express themselves. So, they are preoccupied with the somatic symptoms and there would be cognitive impairment, anxiety as well. So, as a predominant feature which would mask the depression, early signs include reduced concentration and attention, reduced self esteem and confidence, feeling of guilt and unworthiness, bleak and pessimistic view of the future, ideas or acts of suicide, disturbed sleep, and diminished appetite. So, this is as per the ICD 10 for major depressive disorders. So, what are the risk factors for depression? Isolation, the emergence of nuclear families, death of the spouse, diminished vision and hearing, chronic illnesses, polypharmacy, and ADR, special situations like some social causes like death or divorce or certain factors which would or following loss of status because of fall of income, retirement, loss of health, or lack of purpose in life. So there are also other medical conditions which would mask depression. For example, Parkinson's disease, where there would be a masked face in an early evolution of Alzheimer's, neoplasms, and endocrine conditions. So, how do we prevent depression? General measures, pharmacotherapy, and nursing care. General measures include support of the family and the members, caregiver burnout prevention by sharing caregiving and balance, bringing about taking a break for the caregivers, addressing the patient at home rather than institute to avoid confusion, intergenerational engagement programs. So, this is one aspect in the digital era where we could address the senior citizens, people living with dementia, through an intergenerational engagement program. So, what is it? Grandchildren and grandparents are allowed to interact digitally or through telephonic conversations or through video conversations or through video chats, wherein we would uh, the senior would teach the younger children would learn from the senior citizens, plus they would interact. Whenever the senior citizen would have an interaction with a child, he would definitely be cheerful. So the negative symptoms of depression and dementia would come down with an intergenerational engagement program. So these are a few drugs amongst which I'm not describing in detail, but I just want to say that SSRIs are the better ones which could be used. So nursing care is one where we would address the root cause. We would want to address uh, um, the negative symptoms in this and want to uh, see that we would want to prevent the negative impact of suicide prevention by addressing them earlier. So the next geriatric giant is falls and fractures. I would directly want to begin with the causes And there are intrinsic and the extrinsic causes. Intrinsic causes include the neurological causes like the diabetic or other neuropathies, cognitive impairment, postural instability because of joint problems or because of the gait, visual impairment, gait disorders, peripheral neuropathy, musculoskeletal disorders like foot disorders, muscle weakness, osteoarthritis, hormonal osteoporosis, and other factors. So, extrinsic factors include the uneven or improper lighting, the pathways with obstacles on the floor, slippery floors or uneven surfaces, poor lighting, glare of the lamp, low lying furniture, chairs without arm support, inappropriate walking aids, or inappropriate footwear. So, how do we prevent falls and fractures at home? Bringing about changes in the living room, kitchen, bathroom, stairway, and pathways through an image which I have described in this. So, living room and dining room, we could arrange the furniture in such a manner that that would ease the movement of the senior citizens in them. So, remove the caster wheels, use TV remotes and cordless phones so that obstacles are not there in the feet. In the kitchen, we can keep the food items nearby the reach of the senior citizens. The floor shouldn't be polished but should have a rough floor. The appliances cords should be kept away from the floor where they would be walking. Bathroom should instill grab bars and soap dispensers. Stairs, there should be markings and lightings. So other measures include calcium-rich foods, vitamin D exposure, exercise in a graded manner, and a medical alert system. If they are about to fall, as this is for the wheelchairs, where there would be sensors, where we would use Jiren technology and other assistive devices. The fourth of the fifth and uh, the last geriatric giant that I'd be describing is a caregiver burnout. So addressing this issue would help in preventing burnout in the caregivers. So mainly the caregivers are those who would assist the senior citizens with dementia for more than 6 to 8 hours a day. They would help them in their daily household chores and their medical and other needs. So the senior citizens with their illness would unknowingly create a burden, which is emotional, financial, and psychological burden on the caregiver. So the caregiver has to do a triple job of bringing their children, running the house, or even taking care of the senior citizens and even working. So you can imagine what burden the caregiver would go through, and because of the continuous involvement every day, and he has to do it untiringly. So what are the senior care options that are available? We could do address them through here home care or through adult daycare, assisted living, nursing facility, or adopting a grandpa. So these are the senior care options where there would be non-medical facilities of home care, there would be daycare facilities, there would be assisted living, and skilled nursing facility. So what are the tips for caregivers? Managing stress levels, being realistic, and managing the caregiving by turns, giving credit to the caregivers, taking a break, accepting the changes in elderly, and seeing that uh, as a holistic or a religious, uh, or rather an emotional component should be placed first, that they are relatives, and rather than they putting their stress and caregiving first. So as per the levels of prevention, each of the geriatric giant I've put forth in the primordial, primary, secondary, and tertiary level of prevention. For dementia, before the risk factors emerge, we would want to keep the elderly alert and active mentally by cognitive stimulation exercises. We would address the depression. So all the primordial factors I would address first. Depression, we would keep the elderly cheerful and enthusiastic, either through music, through their daily routine, before they would. So early detection or picking the signs before they would manifest the deeper details. So modifying the home and the surroundings to prevent falls before the risk factors have emerged. Caregiver burden, by preparing the caregiver mentally and making him strong or her strong mentally, preventing isolation and neglect by socializing through newspaper reading rooms, through get together, or through digital network in the COVID era. So primary is we would educate or bring about IC activities to the caregivers. We would address the depression by giving awareness about walking or educating them about yoga and IC to the caregivers and the people living with dementia. Polls, awareness, and screening in the OPD, and caregivers. Isolation and neglect can be prevented by newspaper reading rooms or joint family system. Secondary, we would early diagnose through MMSC, Minicog, and appropriate uh, screening tools like the Hindi Monumental Scale, which is adopted for the Indian setting. We would want to treat or prevent the progression by giving memantine or other drugs like the NMDA or other drugs. Address depression through addressing the screening for geriatric depression and bringing antidepressives, the SSRIs. Fall prevention by preventing polypharmacy and drug cascade. And the tertiary level of prevention for dementia is nursing assistance, depression as well, nursing care. Fall prevention, shoes, which could be having sensors, electronic gadgets, with especially the wheelchairs, which would have sensors when the elderly or the people living with dementia would be getting up of their chair. It could indicate which are there in the market. Caregiver burden by having caregivers, by addressing the caregiving through shifts. And lastly, isolation and neglect by adopting a grandpa or creating homes for the elderly. We have a few, three more slides. One related to diet, exercise, polypharmacy, and hormonal replacement therapy, which we would address, and lipid lowering drugs and immunoboosters. That's the vaccination. Pneumococcal once in 5 years, influenza vaccine once a year, a herpes zoster once in a lifetime, and tetanus toxoid once in 10 years, beginning from the age of 50 onwards. Every senior citizen is advised. There are newer initiatives which I just mentioned, the intergenerational engagement programs where the grandparents and grandchildren would be getting together, either through digital network in the in the COVID era or in the non-COVID era. We could address them through different by a family get together. So Meals on Wheels, providing delivery of medicines to home, wellness clinics in the UHC and PHC, and mobile clinics is the need of the hour. So there is one dementia care model which I would want you to explore, which is there in Netherlands, which is a dedicated community for all people living with dementia, which they themselves run, whether it may be a shopkeeper, whether it's a person who is dispensing the drugs. So the whole community is run by the people living with dementia themselves. So you could have establishing communities like these in India would definitely be have a positive impact for people living with dementia. Lastly, I would want to address that we need to add life to years, not years to life. I would want to wish all senior citizens a happy and a graceful aging. With this, uh, I would complete my talk, and I would want to uh, say thank you to Dr. Aksha once again for the opportunity.
Thank you so much, sir. That was a very
Uh,
comprehensive look on all the geriatric giants, and I hope we all got to learn something. Thank you so much, sir. Are there any questions for sir?
Thank you, sir. I think very lecture.
it's not audible. Somebody's asking a
Hello?
question.
Farshta ma'am, you're not audible. No.
Yeah, good evening.
Good evening. Sir, my question was like in the basically in the dementia thing, a lot of the suggestions are more are costly also. Like they come with a cost, and in the community, it is not essential that the families are able to afford um, lock system or something like that. So how can we educate the general community people, especially those below poverty line, and help them with that?
That's a very good question. I would want to address this issue with the resources that every member of the family would have. We would have young children, we would have senior citizens, we would have joint families. Way back in the villages or the places from where we come from, or the origin from where we are. Okay, uh, because of the modern era, we have majority of us have migrated to the urban areas where we would have only a nuclear family. So what I would want to address this issue is through adopting a grandpa, through intergenerational engagement programs. And the third, community screening. So, as a community health professional, so what we could do, pick the signs early, address them through either digital intergenerational engagement programs where there would be mutual benefit to the senior citizens. Every person in India today would have access to a cell phone. So, just a simple app where they could play chess, a grandson would also operate. As any child today in the modern day who is beyond 7 or 8 years would operate an app, or even 10 years would operate an app. So a child who is a minimum of 7th or 8th standard could interact with his grandchild parents. If they wouldn't have their grandchildren, we would approach the school nearby, and we would definitely have 60 students in a class. So or maybe 100 or whatever be the number. So if two grandparents could be adopted by one child, or if two children can adopt one grandpa, this issue would be solved. Okay, we could do it economically. We wouldn't have to spend a rupee. And as per the national program of screening for dementia, and which would come under the National Mental Health Program as well, in the wellness clinics which are emerging, we could screen them for dementia early in the pre-geriatric age group. Okay, that's in the perimenopausal in women and the pre-geriatric age group in men through mass surveys and identify them quickly. So I hope your question is addressed. We could either address it through adopting a grandpa, or we could address through intergenerational engagement programs in the COVID era through a digital networking.
Yes, sir. Thank you, sir. So I also had another question on elderly abuse. Like there's a lot of increasing that, especially they're not able to come out in the open. So how do we pick such things? Like if they're coming to a geriatric clinic, but they're not able to openly
Okay.
share what's happening.
So first thing is be a very good listener. Uh, Talk to the senior citizens with such a manner that how you would be want to be addressed when we would visit a physician, or when we would be speaking to our parents. Simple, like as simple as that. How we would address a person, uh, speaking with empathy, getting his confidence or her confidence, and then trying to address all the determinants which is troubling her. Okay, whether it may be a social determinant, dietary determinant, or the environmental determinant, the health, the morbidity determinant. Take a detailed history of all the determinants which is currently causing this state of hers. If she is having uh, elderly abuse, ask them whether it's a physical abuse, verbal abuse, whether they're whether it's violence related to either hitting or some other abuse. So get a detailed history. There's a questionnaire which I would share with Dr. Shafa at the end, and so that you could use it, which has been devised by one of my senior, Dr. Anand Ambli, who is from BLD Bijapur. So he has devised this scale, and it has been validated on elder abuse. So I could share this across in to you all uh, through Dr. Shafa, and every determinant could be addressed through history taking. So first thing is through empathetic way to address how to. So what's the exact situation? Getting into their confidence and addressing them or speaking to them, just like how we would speak to our spouse or to our parents. So by gaining this confidence, they would open up. Definitely, any elderly would always say. So majority of the times when I was in my preventive medicine OPD, or in the I did speak to, especially during my PG days when I happened to spend time with my senior with the senior citizens, they used to tell me, uh, sometimes my son and my daughter, or maybe my daughter, wouldn't listen to as much empathetically. So they would definitely open up, which they did to me when I was in the OPD. So this would definitely make them lighter. And at the end of the session, they would surely thank you, saying that you did make my heart lighter, or my mind lighter, by just listening to me. So keeping your ears open, documenting important points as per the questionnaire would definitely have an impact, and it would make a senior citizen open to you, irrespective of however introvert he is, or however he is not able to speak out to. Is the question answered? Did you
Yes, sir. Thank you, sir. If you could share the questionnaire, I that
Yeah, yeah, questionnaire I'll definitely share at the end of post the session.
yeah. Thank you.
So, as a follow-up question on that, what is the role of maybe psychotherapy or cognitive therapy in the geriatric population? Because that is probably not something that is talked about very often. And it seems like because they go through so many cognitive impairment and disturbance in their functions, maybe some form of mental health therapy or counseling would be really beneficial. And what is the role of that, and whether it is actually something that is provided in a special home care setup or assisted living setup.
So this is also a very important question. The reason why I'm saying is, we would be training interns, we would be training postgraduates, we would be training geriatricians, but who are the ground, who are the force which would be practically implementing the prescription? Who are the workforce who would be practically being with the senior citizen for a more duration? It's the caregivers, it's the nursing staff, it's the paramedical staff who would be with the caregivers for a longer duration. So we would prescribe, we would take a detailed history, we would examine them, and we would mention to them for a follow up. But more time would be spent by the caregiver, more time would be spent by the nursing staff, and more time by the paramedics. So training them about uh, uh, counseling sessions, especially identifying them, whether it's a non-communicable disease, whether it's a etiology which needs to be related to the aging process. So just making them or training them in such a manner that identifying these common morbidities, firstly. Secondly, uh, making them aware when to refer, when to address it as an emergency, or when to address it before the negative symptoms have emerged, is the role that they would play. Now, second part of the question is related to psychotherapy or cognitive stimulation exercises that you would want to. Training is mandatory for this, and before we put in the senior citizen into this practice, we would want trained professional. So, identifying the negative symptoms would be the role of the nursing staff or the paramedics, trained paramedics or trained nursing staff. Next level would be the role of a doctor or a psychologist or a psychotherapist or a psychiatrist, which would come into picture. And as per the district mental health program, which was a program which was there in as a Ballari model. Okay, it's a district in Karnataka which came as per the national mental health program. It was one model which one district implemented its plan through multiple objectives and through multiple strategies to address mental health issues. So geriatric component is also part of it as a national mental health program, and addressing this issue of depression and dementia, early signs screening has been addressed in this national program. So this is done in the urban health centers as a part of a specialist clinic on second Saturdays, and in the wellness clinics on every Saturday. So this would wellness clinics would emerge in every city, and soon, which is in the phase of implementation. Policy has been done, and it has been the rule, the gazette has been passed, but practical development of the wellness clinics would begin soon. So this could be got in the community itself, just nearby to an urban health center or in a primary health center. So this is the next, which we would find for every senior citizen near our home itself. So its role is very important, but a trained staff doing it would definitely have an impact to identify it quickly and refer.
Okay, sir. Thank you. Are there any other questions?
Should I just take a minute of time to interact with all the staff or PGs, whoever is online?
Sure, sure. Yes.
Could you ask the participants to unmute, please?
Yes, sir.
So,
Sachin, can you please unmute yourselves? Should we have a
so
round of introduction, sir?
no, that's okay. You would have already introduced me in the beginning.
Okay.
So, to all the staff and postgraduates who are online here today, so I would want to address one issue related to senior citizens. Just like the way you would want to be addressed in an OPD, just like the way you would want to be, they would also want to be listened to. They would also want to be addressed. So, helping them open up, helping them reach out to you is our role. So, what we would want everyone to do is just speak out, just listen to them, and I think everyone would be happy to speak. Uh, Adopt small changes like music therapy or making them listen to common music themes or tunes or the songs that they listen to in the yesteryears would definitely have an impact. And one session I would want to ask everyone, one important point I would want to ask everyone. I would want you to every one of you to post a few comments about what you felt about today's session on YouTube. This video would be uploaded on YouTube, and I would want you to share it to as many as individuals as possible. Okay, to reach the motto of to address the motto of reaching the unreached. Okay, this is my request to you. And any queries related to whether it's your just a second, I would share that first slide. Just a second. So you could contact me on my email so that we could address any issue, or you could even call me for any issue that you would feel needs to be addressed. Uh, so during any of the working hours, so I would definitely be happy to address any issues related to caregivers, related to senior citizens, may it be clinical, may it be preventive, may it be related to vaccination where it is available, or rather any newer technique or any method that would address a senior citizen and his or her health issues. So that would be my reach to reach you out, and also through the phone or through the book, anything that is possible. Okay, you could get and connect to me. So that's all I want to share and mention to you all.
Okay, sir. Thank you very much. I think I'll share the number, your number and email ID also with everyone. Thank you very much, sir, for taking the time to take.
Thank you, sir.
Thank you so much for the time and for the session. Thank you, Dr. Shafa, for organizing this event so well. And I want to take leave and
Yeah,
stay connected for any queries or any questions in the days to come. Thank
sure.
you so much.
Okay. Thank you, sir.
Thank you, sir.